Are you familiar with the CAHPS program? CAHPS stands for Consumer Assessment of Healthcare Providers and Systems, and it was started in 1995 as a way to measure patient experience. It's regularly used by Centers for Medicare and Medicaid Services as a way to provide incentive-based payments to medical institutions with high scores. It's also used by state health departments as a way to give consumers and purchasers information that they can use when they're deciding on a health plan. Today, we'll be looking at what the CAHPS program does and how it can help medical institutions improve. I'm Noel with Jotform. Let's go. It really does make sense that having an improved patient experience would result in better patient engagement and outcomes. According to research conducted by the Agency for Healthcare Research and Quality, or AHRQ, encouraging patient engagement coincided with improved patient outcomes, including fewer falls, fewer medication errors, and shorter hospital stays. This is thanks to surveys conducted with the CAHPS program. So what exactly does this program do? The CAHPS program works to oversee, fund, and work with research organizations to gain insight about patient experience through surveys. In these surveys, consumers and patients are asked about their experiences with health plans, providers, and facilities. Then the program shares these results with interested audiences. There are a variety of aspects covered regarding the patient experience in the survey, which focuses on questions best answered by patients, including how well healthcare providers communicate and how easy it is to get an appointment. One thing to note is that patient experience isn't the same as customer satisfaction. Customer satisfaction surveys focus on how happy a patient is with their care, but patient experience surveys take a more holistic view. They look into how often a patient communicates with their provider and how well they understand certain medical instructions. There's a wide range of interactions that need to be covered when discussing patient experience. It's not just about what happens in the doctor's office or the hospital room. It's also about how easy it is to make an appointment and access vital information. But how can the CAHPS benefit healthcare providers? One of the biggest benefits that this program offers healthcare providers is a chance to identify any weaknesses that they have with treating patients. For instance, when conducting a CAHPS survey, a medical institution may realize that their patients are waiting a long time for an appointment. Knowing this information could encourage the institution to hire more practitioners. Plus, a good CAHPS score can increase the reimbursement that medical institutions get from CMS. The Merit-Based Incentive Payment System, or MIPS, offers high payments to those who receive high CAHPS scores. Since medical institutions get patient feedback through CAHPS, they are now able to make effective adjustments in the care that they provide their patients. For instance, they can improve the way they give post-operative instructions. This will then improve patient outcomes since they will better understand their doctor's instructions. In addition, CAHPS surveys can also improve patient safety practices. For example, a survey could reveal that the information on medicine labels is inadequate. Healthcare providers can then correct the medication and dosage for patients. Now let's look at how you can create your own CAHPS survey. There are a few things that you should keep in mind. First, your survey should focus on questions where the patient is the best source of information. You can ask them whether they felt their healthcare provider treated them with respect. You should also focus on asking questions about the care they received or could directly observe. When you're drafting questions, remember that they should focus on all aspects of the patient experience. This includes the moment a patient calls to make an appointment to their post-visit or post-discharge experience. You should also include a specific time frame as a reference, like the past year or the past 6 months. If you want to implement CAHPS surveys in your own medical institution, you can use one of Jotform's CAHPS survey templates. Along with these templates, you get a selection of sample questions that you can tailor to your organization, which will help you get the feedback necessary to improve the patient experience and patient outcomes. Let's review. The CAHPS program works with organizations to gain insight about patient experience through surveys. Surveys like this can greatly benefit healthcare providers. They can help institutions identify any weaknesses that they have when it comes to treating patients. By extension, this will improve patient outcomes. If you're looking to create your own CAHPS survey, you can do so with Jotform survey templates. Overall, you're trying to both improve processes and procedures as well as the care you deliver to your patients. Well, thanks for watching. I'm Noel with Jotform. See you next time.